Hi, my name is Humberto, and I am a housing coordinator at a housing community development department within a medium-sized U.S. city. I obtained my master's in public health and global health with a concentration in community health and development. Before then, I worked in corporate America, including financial services. I also worked in the nonprofit sector and the clinical research sector. I currently work full time in this role where I'm focused on helping people, something that I've always gravitated towards when I grew tired of corporate America. I focused my efforts on nonprofit work, though it was primarily volunteer work. I was particularly invested in HIV work, which is something personal to me as someone with lived experience. I've always gravitated towards helping people who have been marginalized because of my intersectional identity. I belong to many communities, including the LGBTQ community and the immigrant community. I experienced health inequities and was further motivated to continue reaching towards systems change after witnessing how systematic failures impacted my communities. I am very focused on this people-centric work because it is both rewarding and challenging. I currently work with vulnerable populations, with people who are experiencing or have experienced homelessness and trauma. So at the core, I'm providing support to get them to a state which promotes their well-being and moves them close to thriving, not surviving. Another aspect of this role I enjoy is that every day is unlike any other, or unlike any other. I get to plan my week with flexibility. It's a hybrid role, which means that I get to be out in the community or the office for 3 days, and the remainder of the week is spent working from home. And while working from home, I am filling out case notes, ensuring that I make the most out of the day to complete my administrative tasks. In addition to these responsibilities, I'm tasked with helping my manager conduct program evaluation tasks to identify improvement opportunities as well as developing program policies and procedures. And the skill that I use the most on a day-to-day basis has got to be problem solving. Teamwork also is a key skill in this role. I work with the team of four, so I have to ensure that I work well with each member of my team because we do rely on each other to problem solve. And we also work collaboratively to ensure that all the participants in our program reach their goals. And in previous roles, I've used grant writing, program evaluation, and program development, among other skills, such as community engagement, connecting with people, using various communication tools, tailoring communications to varying audiences. So, as I reflect on how I have ended up in this type of work and in public health, I can't deny that housing was not on my radar when I was planning my post-MPH job search. However, the more that I thought about it, access to affordable housing is one of the biggest, if not the biggest, social determinant of health. In other words, in order for any of us to obtain health, we must have stable housing. My lived experience combined with previous professional experiences, such as running a nonprofit where I wore many hats as board president, helped me realize the importance of helping people who were disadvantaged by systems that were not made for them to thrive in. My journey with HIV has also pushed me to work towards a master's degree because I knew that in order to be an effective change maker in public health systems change, it would be advantageous to earn a master's degree. Once I let go of the internalized stigma and shared my status with the world, nothing would hold me back and get in the way of reaching that goal. Now, if I had to give any advice for doing impactful work in public health, I would encourage students to do a lot of community-centered work and commit to rolling up your sleeves. I'd also encourage you all to get to know and make inroads with community-based organizations that are doing the work to improve the lives of people that you care about. I'm a strong believer that in honing your emotional intelligence skills early on in your studies and professional experience because working with people requires that we are prepared to serve people from diverse backgrounds. And having a basic understanding of trauma-informed care go a long way to becoming an effective public health leader if you choose to do community-centric work. And another piece of advice is to seek out those experiences that will give you insights into how different sectors work, meaning try the corporate sector and nonprofit sector. Don't be afraid to fail. And lastly, one piece of advice that I always share with people of all backgrounds is that you have to be willing to talk to people across the aisle. And that includes people in public health, talking to people that aren't in public health. There's this divide that we need to work at chipping away. And this is because cross-sector collaboration is key to solving many of the issues which lie ahead.